Remember when measles was history? Well, guess what? It's back. In both the United States and the United Kingdom, measles, a disease once wiped out through vaccination, is spreading again. Why is this happening in countries with some of the best healthcare systems in the world? Is it misinformation, pandemic fallout, or something deeper? Let's find out. This is Health Arc, where we decode the world's biggest health stories, one fact at a time. Measles isn't just a childhood rash, it's one of the most infectious viruses known to humanity. One person can spread it to up to 18 others. It starts with fever, cough, and red eyes, then comes that unmistakable rash. But here's the scary part. Measles can cause pneumonia, brain swelling, and sometimes death. Decades of vaccination nearly erased it, until now. In England, measles cases hit 2,900 in 2024, the highest in over a decade. By mid-2025, over 800 new infections had already been confirmed, mainly in London, Bristol, and Manchester. Tragically, a young child in Liverpool died from measles this year, the first death linked to the outbreak. Meanwhile, across the Atlantic, the United States is facing its worst measles surge since the 1990s. By April 2025, over 800 cases were confirmed in 25 states, with Texas alone recording more than 750 infections by June. The CDC reports that nearly every single case happened in unvaccinated people, and one outbreak in a New Mexico correctional facility even spread among inmates and staff, proof that measles doesn't discriminate. So what's behind the comeback? Let's break down the main culprits. Falling vaccination rates. Measles spreads like wildfire, and to stop it, 95% of people need 2 doses of the MMR vaccine. In London, only 81% of kids get their first dose. In the US, rates have slipped to 93%. That small gap? Big enough for measles to break through. B. The COVID-19 pandemic didn't just disrupt life, it disrupted routine immunizations. Clinics closed, staff were reassigned, and millions of children missed their shots. Even now, catch-up campaigns haven't filled the gap, as one UK health official put it. The pandemic created an immunity debt, and measles is collecting. Call. You've probably seen it online. Claims that vaccines cause autism or weaken immunity. These nets were debunked decades ago, but social media keeps giving them new life. In both the US and UK, misinformation, mixed with distrust of institutions, has fueled vaccine hesitancy, especially in tight-knit communities. And the virus loves those pockets of doubt. D. Measles anywhere is a threat everywhere. In 2025, several UK outbreaks were linked to travelers returning from Europe and Asia. In today's connected world, one infected traveler can start a chain reaction that spreads across borders in days. Measles isn't just a public health issue, it's a social wake-up call. Beyond the fevers and rashes are emergency room visits, hospital costs, and lives changed forever. In the US alone, each outbreak costs millions in contact tracing, quarantine, and healthcare response. And for the families who lose loved ones, the cost is immeasurable. The best part? We know how to stop this. Get vaccinated. 2 MMR doses offer 97% protection. Catch-up campaigns are rolling out across the UK and US right now. Community leaders and schools are stepping up to rebuild trust, and public health teams are tracking outbreaks faster than ever. Measles can be beaten again, but it takes all of us to make it happen. Measles made a comeback, but it doesn't have to stay. The real question is, will we let misinformation win, or will we choose science and protect the next generation? Thanks for watching Health Arc, where facts matter and your health comes first. If you found this video helpful, like, share, and subscribe for more science-backed health stories every week. Together, let's turn the tide, one vaccine at a time.